Good morning, I'm Taylor Wilson, and today is Monday, August 11th, 2025. This is USA Today's The Excerpt. Today, how an Israeli strike killed Al Jazeera journalists in Gaza. Plus, there's a war brewing between medical groups and RFK Jr. And we talk about grief camp. A prominent Al Jazeera journalist who had previously been threatened by Israel was killed along with 4 colleagues and others in an Israeli strike in Gaza yesterday. Israel's military said it targeted and killed Anas al-Sharif, alleging he had led a Hamas cell and was involved in rocket attacks against Israel. The news organization Al Jazeera rejected that claim, and al-Sharif had previously rejected Israel's claims that he was connected to Hamas. A local freelance reporter was also killed in the airstrike. The war between Israel and Hamas in Gaza is the deadliest on record for journalists, according to the Watson Institute for International and Public Affairs Costs of War project. And the Committee to Protect Journalists said at least 186 journalists have been killed in the Gaza conflict. Experts say a back and forth between Robert F. Kennedy Jr.'s Health and Human Services and the nation's top doctors is creating confusion and sowing distrust among patients. I spoke with USA Today health and wellness reporter Adriana Rodriguez for more. Adriana, thanks for joining me.
Thanks for having me.
All right, so let's just start with the latest news around the COVID-19 shot. How did Health and Human Services Secretary Robert F. Kennedy Jr. change guidance here?
So previous guidance stated that most people would be able to get the COVID shot. You would be able to go to any pharmacy and get it almost like a flu shot. Now recommendations have kind of changed. RFK said that the vaccine is no longer recommended for healthy children and pregnant people. So that's the biggest change.
How has all this landed with doctors on this move?
Not landing very well. Several medical groups have publicly voiced their dissent, and the most important, obviously, are American Academy of Pediatricians, because those are doctors of children, and then the American College of Obstetricians and Gynecologists also disagreed with this and said that this was not rooted in science, so most doctors are not reacting well to this.
Well, Adriana, we know this isn't the only shift we've seen from RFK and his administration. What other changes has Kennedy made since taking over?
Taylor, what hasn't changed? And this has all happened within the past couple of months, so it's a whirlwind. In June, he fired a key vaccine panel called the Advisory Committee on Immunization Practices. He fired all 17 members, and this vaccine panel basically votes on these recommendations based on science and evidence for American people, saying, this group of people are recommended to get this certain vaccine at this time or based on their age, something like that. So he fired all 17 members of that key vaccine panel in June. Not too long after, he hired 8 new members, and they didn't go through the typical vetting process, which could last for a year or more to get these members on that vaccine committee. And he also included some vaccine skeptics that are known vaccine skeptics. After that, he also banned medical groups. This is more recently. He banned medical groups such as the ones that I had mentioned previously, like AAP and ACOG, from work groups in this committee. And so these work groups typically assisted with vaccine reviews, and they also crafted recommendations for the committee members to vote on. He also announced recently that HHS will be canceling funding to develop projects involving mRNA technology. mRNA is a type of vaccine technology, and this vaccine technology was used by Moderna and Pfizer's COVID vaccine.
I mean, just functionally, what are we hearing in terms of what this back and forth between the department and the nation's top doctors is actually doing to patients on a kind of day-to-day level?
I think most patients, they're not really tuned in to the specifics and details of ACIP and ACOG and the American Medical Association and the inner workings of the FDA and all those sort of health agencies. They mostly trust their family doctors, but obviously they hear things, right? They see these headlines. So they're hearing things and they're really confused. And so they would go to their family doctors for information. The problem here is that the family doctors also are confused. And so it's hard for them to accurately inform their patients when they really don't know who is recommending what, and most of all, if their insurance will cover the care that they're inquiring about.
Adriana, who really is pushing back and how are they doing so?
All the major medical groups are pushing back against RFK's changes. I know the American Academy of Pediatrics had refused to attend that first key vaccine panel meeting that we had talked about. The American College of Obstetricians and Gynecologists announced they're no longer accepting federal funding. And a few other medical organizations are suing RFK for changing the COVID vaccine recommendations.
Where do you see this conversation going next, Adriana?
I ask these to experts all the time, and they're like, we have no idea. Anything could happen. But we do have a few things coming up that, we're looking at. There are concerns that RFK might fire another panel of experts, health experts. It's called the U.S. Preventive Services Task Force. He recently canceled one of their meetings. And so people are sort of looking towards that committee and wondering, okay, if he canceled this meeting because he did that before with ACIP, before firing all of the ACIP members, will he do this again to this committee? And this task force is really integral in deciding preventive care, like screenings and what sort of medications should be covered by insurance under the American Affordable Care Act. And he's publicly criticized this task force before. So that's something that we are keeping an eye on.
All right. Adriana Rodriguez covers health and wellness for USA Today. Great breakdown for us as always. Thanks, Adriana.
Thank you.
The Trump administration is using hundreds of federal police officers to target crime in Washington, D.C. as part of President Donald Trump's public safety push in the nation's capital. The White House said 450 officers from multiple federal agencies were deployed in high-traffic D.C. areas and other hotspots over the weekend. The officers are from 18 agencies, including the FBI, the Drug Enforcement Administration, and the Secret Service. Trump ordered an increased law enforcement presence in D.C. on Friday after complaining about crime in the city, even as violent crime declined by 35% in D.C. in 2024, according to data compiled by the D.C. Metropolitan Police. Meanwhile, Trump said on Truth Social yesterday that the homeless in D.C. have to move out immediately. He said he would unveil a new initiative later today. You've got mail, no more. AOL is set to shut down the dial-up internet service that once was the symbol of internet connectivity after more than 4 decades. A company webpage titled Dial-Up Internet to be discontinued states that the service will be stopped on September 30th. A dial-up modem was how many people first connected to the internet. At its height, a dial-up connection could manage up to 56 kilobits per second under ideal conditions, according to Apple Insider. Modern connections are measured up to gigabits per second. How to deal with grief. It's different for everyone, but one summer camp tries to tackle it. I spoke with USA Today Deputy Wellness Editor David Oliver about Grief Camp. David, thanks for joining me.
Of course, thanks for having me.
So just starting here, David, what is this Grief Camp and what are its aims?
It's the One Centers Grief Camp in Washington, D.C. The aims are to really help kids of all different ages process grief. And the plan is not to cover all of grief in one day. Obviously, that's impossible, but it's sort of to give kids a refuge to talk about their grief in a safe space among other kids who have experienced the same thing, which might be rare for them, especially because they're so young. They probably don't have peers in their regular day-to-day lives who've also experienced grief. The camp is split up between a number of different ages. So when I went to Shadowbus camp a few weeks ago, I went to the day that was ages 13 to 17. So a little bit of the older kids compared to the younger ones.
Well, tell us a bit about your experience visiting, David. What sorts of activities did you witness or take part in?
There was this art therapy thing where they were painting with this acrylic paint and also oils, and they were kind of creating almost like a collage of sorts. It was in memoriam to the person that they lost, and it was very beautiful. Some people wrote a lot of words, some people used more symbols, and it was all just this idea of commemorating something for their loved one and also something that they could add to later. The instructor emphasized how this wasn't a finished product, which I thought was interesting because, grief is not something we ever finish. I watched them do some theater exercises. I was more on the side of this one. They had to all stay organized and make like a shape together, like an exclamation point, and kind of work together without really saying all that much to figure that out, which is pretty cool. They did some dancing to go-go music, and I guess blew off some steam, a lot of laughter. Really a lot of laughter throughout the day, I think, generally, which you wouldn't necessarily think from a grief camp. They had some private grief therapy sessions that I didn't get to see, where I know the tears were shed and that got very emotional. But in some of the other activities, there was a lot of joy and laughter, which I think spoke to the fact that grief is something that it's going to be all kinds of emotions. When you're remembering someone, you remember the good things, the bad things, the in between things. And I think that the camp really captures that throughout the day.
In terms of any conversations you had, David, did you speak with any of the campers or any of those working the camp? What did you hear from any of these folks about what this camp means for them?
The campers themselves, I really got to know based off mostly in art therapy, just sort of talking with them about what they were doing. And I mean, I think some were more shy, but some were upfront. Like, I made this for this person. This was their favorite color. This was my favorite color. This reflects our relationship. They were very open about that, some of them, and just it moved me. I think there's something about when you've experienced the same thing as someone and you're in a room with them and having a conversation, it's just almost like an unspoken language. It's easy to talk to someone. Like there was someone there, a volunteer who just struck up a conversation with me at one point. Was like about my height and my age, and we had both lost our dads like unexpectedly. And it was just such an easy like recognition that I felt the last few years since my father's death, where like anybody who's been through a similar loss, I can like see it in their face. And it's a weird thing and hard to explain, but you just kind of know. And this was a day of really just knowing that everyone I spoke with just had that same quality. And especially this person who, like I said, was more reflective of my age, when a lot of my friends, for example, like haven't gone through this, thankfully. So that was very special overall.
Well, you mentioned your father's passing, David. I'm so sorry for your loss happened in recent years. I know you write about this in the piece. Did you find this camp healing for you as well?
Thank you very much. And I did find it healing. I think that I'm always looking for and thinking about kind of new ways to write or think about or process grief. It's part of why I pitched this story in the first place. And it did, I think, even more than I expected. I think I thought that I would more witness what other people's grief experiences were like. And then I would maybe like later in the day more reflect. But really during camp, I got really brought back, not necessarily to the saddest parts, but to just really thinking about my dad, like this person who meant so much to me and all of that love and time. And it just made me feel very vulnerable, but in a good way. And it made it easier, I think, to then write about later because I could kind of remember those emotions again, along with my notes from like the journalistic perspective and put together something that I think honored, multiple truths at once in terms of writing about other people's experiences and then writing about my own. So I did find it healing. It was very nice.
This was a really powerful piece. I'd love for the listeners to go check out the full version. They can click on a link in today's show notes to do that. David Oliver is USA Today's Deputy Wellness Editor. Thank you, David.
Thanks so much for having me.
Thanks for listening to The Excerpt. You can get the podcast wherever you get your audio. And if you're on a smart speaker, just ask for The Excerpt. As always, you can email us at podcasts@usatoday.com. I'm Taylor Wilson. I'll be back tomorrow with more of The Excerpt from USA Today.